What is wrong with the way we're addressing the mental health crisis at the moment? Just a few thoughts. By now, we've all seen the headlines. Anxiety is skyrocketing, depression is more common than ever, and substance misuse continues to wreak havoc on lives. Some are calling it the second pandemic, and they're not wrong. As a psychotherapist, I've seen the crisis play out up close, in the faces of my clients, the stories they share, and the unbearable wait times they endure before they can even step into my office. You don't have to look far to understand why so many people are struggling. Economic uncertainty, social isolation, the relentless churn of the news cycle. It's no wonder mental health issues are on the rise. Yet what's truly troubling isn't just the scale of the problem, it's how woefully inadequate our current systems are at addressing it. First there's the financial barrier. Let's talk about money. Mental health treatment is expensive. A single therapy session can cost as much as a week's worth of groceries. And for those in crisis, one session is really enough. Private treatment is, simply put, out of reach for many, while public options, where they exist, are stretched paper thin. Insurance coverage for mental health services is notoriously patchy, leaving countless of individuals to decide between paying rent or addressing their mental health. And for those with limited financial means, the system is almost designed to fail them. And this is particularly glaring when we consider the disproportionate impact on marginalized communities. And they face not only higher rates of mental health issues due to systemic inequalities, but also greater difficulty accessing the care they need. The endless wait. If you're fortunate enough to overcome the financial hurdle, you'll likely encounter another roadblock: Father Time. In many public systems, wait times for mental health treatment can stretch for months, frankly, even years. Imagine summoning the courage to ask for help, only to be told, "Come back in 6 months." And this isn't a mere inconvenience, it's often a matter of life and death. Mental health conditions don't politely wait for appointments to become available. They worsen, metastasize, and create ripple effects that extend to families, workplaces, and communities. Just think of any presenting problem: substance abuse. Delays in treatment then mean preventable suffering becomes prolonged, and manageable conditions spiral into crises. And then there's stigma and silence, the elephant in the room. Stigma. Despite progress raising awareness, mental health remains cloaked in misunderstanding and judgment. Many people still view seeking therapy as a weakness, a flaw to be concealed rather than a step towards healing. And the problem is compounded by a lack of education. Too often, people don't know what help is available or what they're experiencing. Anxiety is dismissed as stress, depression as a bad mood. Without understanding, many suffer in silence, convinced that what they're going through is normal, or worse, that it's their fault. And then, overall, it's a fragmented system. Even when help is sought, the mental health care system is often fragmented and underfunded. Government budgets for mental health consistently lag behind those for physical health, as though the mind and the body were somehow separate entities. Services that should work together, joined up, therapy, medication, management, community support, are siloed, leaving individuals to navigate a labyrinthine system on their own. Add to this the burnout among mental health professionals. It's hard to help others when you're drowning yourself. And too many therapists, counselors, and psychiatrists are leaving the field due to overwhelming demand and insufficient support. And yet, there is a glimmer of hope. The rise of AI and digital mental health tools offers an unprecedented opportunity to bridge the gaps in the system. Advances in neuroscience and decades of psychological research can now be synthesized into accessible, round-the-clock support. AI-driven chatbots and telehealth platforms are already making it easier for people to access help without the delays and expense of individual care. But let's not oversimplify. These tools are not a panacea. Technology can augment human care, but it can't replace it. And for those without access to reliable internet or who distrust digital, so what do? The mental health crisis demands a multifaceted response, and we need increased funding to make care affordable and accessible. We need to reduce wait times by training and retaining more mental health professionals. We need to dismantle stigma through education and conversation. And we need to use technology thoughtfully, ensuring it complements rather than competes with traditional care. Most of all, we need to treat mental health with the urgency and respect it deserves. The cost of inaction is measured not in pounds and dollars, but in human lives. And that's a price none of us can afford to pay.